My name is Bivek Wagle. I'm a PGY for Ophthalmology resident here at The Ohio State University. Initially, I got interested in global health outreach because of my childhood in Nepal. I grew up in Nepal, witnessing healthcare disparities and how a preventable condition can also be detrimental to somebody with a lack of health education, with lack of specialists, and with lack of resources. In November 2023, for 10 days, I went to global ophthalmology rotation in Nepal. At that time, I did my rotation at two different hospitals. The first one was Tilganga Institute of Ophthalmology. This hospital was located in Kathmandu, which is the capital city of Nepal. This is a very high volume hospital and a premium eye care center in Nepal. Patients are referred from all over the country to this hospital. It was founded by Dr. Sanduk Ruit, who is a giant in the field of global ophthalmology, having established Himalayan Cataract Project. So the next experience I had was NNJS Surgical Eye Care Center in Tamgas. That is about 16-hour drive from the capital city of Nepal. This is a city that is located more than 6,000 feet above sea level. So it was a beautiful place, but very limited by resources and infrastructure. I was part of a team that did manual small incision cataract surgery. My experience in Nepal is what initially sparked my desire to go to global health outreach. I grew up in an environment where lack of healthcare access, education, and specialists lead to people suffering detrimental consequences, even with preventable diseases. So I wanted to go and make some changes. I grew up in Chitwan, Nepal. That's about 4 hours far from the capital city. I was there up until 18th year of age. My extended families are still back there. My grandmother is still back there. This trip in November was also special because we were all going back to Nepal for my brother's wedding. So not only that I got to experience global ophthalmology experience, I also got to enjoy time with my family. Some of the highlights of my trip: patient encounter was the main highlight. Seeing how healthcare is done in a limited resource setting was the next thing. Third, I got to meet Dr. Ruit and his team. Meeting these esteemed surgeons from Nepal, that was remarkable. Lastly, from this experience, I was able to submit some papers to national meetings that were accepted, and I was able to present at Atlantic Coast Retina Conference 2023 and AAO 2024. Global outreach projects are not only for clinicians, there's a role for everybody. And if somebody is not able to go abroad, do these things themselves, they can always do things from home, such as donating money to non-profit organization. Here in our department at The Ohio State University, we have a couple of endowments and funds for residents and trainees to go abroad and be involved in global health. So I encourage people to be part of that and also donate to those funds.